Hello and welcome to Right Idea, where we discuss the people, policy, and politics that drive Texas. I'm your host, Brian Phillips. I'm the Chief Communications Officer at the Texas Public Policy Foundation. And not with me today, as usual, is our Chief of Research, Derek Cohen. He's taking a little time off. He's busy here and there. Apparently more important things to do than to be here with you on our very important podcast. But we will shame him for that later. So we will dispense with our normal tomfoolery that we do here at the beginning. So apologies for that, and get into my favorite segment, which is the shameless plug for our newsletter, our fantastic newsletter called The Post. You can subscribe to that at texaspolicy.com/The Post. It always has some new exclusive information, a little column that I write right at the top, but always some fun stuff about Texas and the goings on and what's going on in policy and politics here in the state. So you can, again, subscribe to that at texaspolicy.com/The Post. So we will jump right into our interview, the most interesting part of any of our podcasts. Representative Caroline Harris Davila proudly serves the Texans in House District 52.
Yes, sir.
Caroline, Representative Davila, thank you for being with us today.
Thanks for having me.
Elected at only 28 years old.
Yes.
She is now, cannot hold that mantle. She's now the second youngest female Republican.
Yes, I am.
To ever have been elected in the House of Representatives. She earned her master's at, near and dear to my heart, my Texas Longhorns at the University of Texas. So Thank you for being a proud Longhorn. But one thing that Representative Fairley cannot claim, at least yet, is that Representative Davila was named the GOP Freshman Legislator of the Year in her first session. Freshman Legislator of the Year in her first session. She sent 13 bills to Governor Abbott's desk in her very first session. So
I like to stay busy.
That is amazing. Love to get into that and talk about why that is. But probably the centerpiece of all of that, at least from our perspective, was a bill, SB 490, which improved transparency in healthcare billing. Essentially, it's forced. We'll get into it, but forced providers or required providers to let you know what something costs.
Yes.
Before you actually pay for it. Imagine that. But a couple things I want to get into just right at the jump to learn about you and your interest in all of this. One thing that I saw, and thank you very much for being on the podcast here. Yeah. Super busy over there at the Capitol, so thanks for making time for us.
No problem.
You are a founding member of the Make America Healthy Again Caucus in the Texas House. So the founding member of MAHA. RFK Jr. is, of course, making a lot of waves, making a real effort to revolutionize healthcare and nutrition at the federal level. So what do you, obviously you're paying attention to all that. What do you think so far of his efforts?
I'm so grateful that he is now in a position where this is just widespread, where he just has such a big platform and can talk about all of these things. And I love it because a lot of it is, we're smart people and we can make, great decisions, but sometimes we just don't have the information. So he's just bringing all of this information to light that is out there. It's just hard to put together and be able to kind of dissect all together. And, I actually kind of saw or became more passionate about this, I should say, during COVID, because during COVID, we learned a lot about, the effects of COVID and kind of the effects of, like, if you were overweight, for example, you were at higher risk for COVID, and then all these other factors, right? And then we learned that if you had higher levels of vitamin D, you were less susceptible to COVID and things like that. And the conversation was all about the vaccine and medicine and pharmaceuticals, and no one was talking and no one was talking about the fact that if you go take a 20-minute walk outside, which is free, you're probably going to boost your vitamin D levels. If you eat the right way, you may lose weight, maybe you'll be less at risk. So there were so many things that at that time, while everybody was so honed in on health, the government had the opportunity to talk about this stuff.
So
and
we were
really,
too busy binge watching Tiger King at the time, I think.
I forgot about Tiger King.
Yeah, 20 minutes. You can take 20 minutes away from Tiger King.
Exactly. It's so true. But
that's a really good point. And it sounds like, so is this something that sparked your interest because of COVID and all of the controversy around there? Or have you been looking at healthcare issues, your whole career?
I have. So I'll back up. I worked for Senator Hughes when he was a representative for 2 years, and then in the Senate for 6. And so when I worked on policy with him, I worked on on health policy.
Okay.
And I love working on healthcare policy because it touches every single person.
Right.
Young or old, you're going to interact with the healthcare system at some point. And the other statistic I like to tell people is, most Americans have debt that is due to medical procedures or some form of healthcare.
Right.
And so that's something that's so personal. And that's why, we'll get into this a little later, but that's why I love to work on bills that increase transparency in healthcare, because if you're going to go into debt to pay for something you need, a procedure or whatever it is, we could at least give you the courtesy of knowing, what it's going to cost up front so that you can plan out your finances. You're paying for it.
National polling will usually show that at times when we don't have, a crisis at the border or we're in a depression or we have a pandemic or something, that healthcare is a top 3 issue. It's something that's on the minds of people all the time for the reasons that you said, because we're always interacting with it, because there's such a high cost, because insurance is always so frustrating and maddening. And yet it's one of those issues that doesn't really make the headlines. It's not the sexy issue to work on healthcare issues. Is that one of the reasons why you started looking at these issues, is because it was so important to people, despite the fact that it's not the thing that's going to make the nightly news.
That's exactly right. And I also look at it as it's a really difficult topic or policy area to infuse conservative principles into, because it's super complicated and complex. And so
what do you mean by that? I'm interested with your
just making it more free market, for example, making sure it's competitive, making sure there's transparency, these kind of tenets of our conservative Republican beliefs, that we want to make sure that the market is working, the free market is working for people, because we know that's the best. We've seen it in America, we've seen it in Texas. We know that's the best. And so things like that, it's just hard to infuse those into healthcare and make the healthcare system better in that way. Yeah. And so that's one reason I like to work on it. But the other reason is I love to take important topics like this and really simplify them, not take anything away, but just simplify them and create a messaging point around them. Right. And so you just put a human face to it, right? You talk about, in my case, I talk about my constituents. I had constituents who were being sued by a hospital for medical bills lower than $5,000 in some cases. Wow. And these are single moms with kids that are having to go on a payment plan for something they didn't even know was accurate or not, because they weren't given an itemized statement after they received the health care. And so when they went to court, there was no way for them to prove that they had already paid for it or they were wrongly charged. And so it's cases like that that really help everybody understand these issues better, and it helps you to champion them better too.
Ironically, it was COVID that exposed some of these kinds of issues. There's a really famous New York Times article that we used a lot here in pushing for more transparency. And it happened here in Texas. I think it actually happened in Central Texas, where 2 friends went to get the initial vaccine, and one person, their insurance paid like $800 or whatever for it, and another one was $7,000, and it was literally like 2 friends. They actually shared the same car, I think. Went to the same doctor, so everything was lining up, except that one had one insurance and they paid $800, and the other one had another insurance and it was $7,000 for exactly the same shot. And those kinds of examples really boosted and fueled this push to get more transparency and especially healthcare billing.
Oh, absolutely. And the other thing I like to remind people is, when you're a state representative, the other part of your job is taking care of constituents. So some of those are my family. I represent the area I grew up in. And so I had several cases where, insurance wasn't approving certain, medical procedures or, the right tests or whatever it may have been for some of my constituents. And so I would make the phone call and try to see how can we help them? What can we do? And it was so difficult for even me to try to help my constituents that I thought, oh my gosh, anybody who's trying to handle these issues on their own must just be completely lost. Like, if it's difficult for me to navigate any of this and being an elected official, trying to do it on behalf of my constituents, I can only imagine the headache. And I have experienced that on my own, But anyway, that's another reation why I'm passionate about it.
That's what was interesting about, preparing for this interview is like I'm using a lot of my own personal experiences and in the healthcare industry, and some have been great. Some, sometimes it's you're actually getting the care you need, and the insurance pays for it. And then other times you're like, this is crazy. Why did I get this bill and I can't get anybody on the phone? I want to jump back to MAHA real quick.
Yes, absolutely.
Because there's a big federal push. I believe there's state legislation for this too. Correct me if I'm wrong, but there is certainly a big federal push to prevent welfare and SNAP benefits from being able to provide essentially junk food.
Absolutely.
I think the vast majority of people look at that and say, well, of course, if this is going to be tax dollars, we want to make sure that people are getting well fed, getting nutrient rich foods and those kinds of things. Why are we paying for Cokes and candy? The other side, is more of a libertarian bent, would say, hey, if you're going to give them money, then they should be able to spend it however they want to. Where do you come down on all that?
Well, I'm definitely not for taxpayer money subsidizing our big soda companies or junk food companies. So that's kind of the way I look at it. There is so much money in these programs.
Right.
I mean, but if you look at the entire United States and everybody's food benefit programs, you can only imagine how much money goes to these companies that provide the junk food, that, distribute this, that produce it, right? And so that's the way I look at it. Why are we as taxpayers subsidizing, these companies when we know it's also poisoning the very people that we're trying to help? And the other thing I bring up is, if these same people that we are, providing food for are also on Medicaid or Medicare, then why would we feed them horrible food or allow them, feed them horrible food or make that available to them when we're also paying for their health care, when we know that we're making them sicker. We know that through them eating these chemicals and the processed foods, they're actually getting sicker, which means the state's paying even more on the back end for their health care.
That's right.
And part of this too, it's not just about banning soda or banning junk food or whatever, because I also believe in personal responsibility. But I think a lot of it goes back to education, just having access to that information. So, you go to the grocery store, well, why am I not allowed to buy the junk food with my STAT benefits anymore? What's up with this, right? And so there also needs to be that education piece where they understand the reason why is because we want you to be healthy, and here are the healthier options. And did you know that these chemicals can do this to your body?
Right.
I think that's another part of it that we also need to talk about.
Yeah, I've listened to several podcasts and other folks talk about this, and it was kind of especially once Trump had just nominated RFK to come in as secretary, and I just found myself listening to like an hour-long podcast, and it's all this great information about all this awful stuff that goes into the things that I eat. But I'm just like waiting, like, okay, well then tell me what to eat. Like, what's the next?
Exactly.
What's the okay? So you got 45 minutes of like all these chemical names and everything, and I'm looking at the back of the stuff that I have in my. I'm like, it's in there. What is sodium benzoate? I didn't know what that is. And I'm throwing everything out, but then I'm like, what do I? So somebody tell me where, and then then that's when they say, go to my website, and for $19.95, we'll put together a nutrition plan for you. So what do you eat?
Oh, that's such a good point. and I'll give you a case study, right? Like I'm a nerd on this stuff too. I like to listen to podcasts and all this stuff. Well, the other day, you know how it goes during session. Man, there's like cookies and donuts everywhere all day, right?
Pizza,
So
late
yes,
night,
all the
everything,
carbs.
Yeah.
So at the beginning of the session, I was like, okay, I'm gonna try to do better and start off right. So I was doing keto, right? Like low sugar, no carbs. And the brand Quest, I don't know if I'm supposed to say brand name, so maybe forget that part. But anyway,
they're not a donor or not a donor. I don't know which one it matters.
But I was looking, I had these, this kind of candy that was like low carb, low sugar. And it occurred to me, you know what? I've never looked at the ingredients. I just assumed it's healthy because it kind of falls with, falls with what I'm eating. So I read the ingredients, and it's all sorts of like soybean oil, canola oil, like all these things that I've been reading about that's so horrible. And it didn't even occur to me because it's marketed as healthy and kind of a diet food. mood. And yet it's got these things that I just read were not super great. So to me, the way I do it is I just look at it as a gradual lifestyle change. Like, how can I slowly incorporate healthier things into my life? Because I know you can't do this stuff overnight.
Yeah.
You know, you can't just throw out everything, all the food in your house.
Stuff my kids eat.
Exactly.
Come on, Dino Nuggets. What are you doing to me?
Exactly.
I swear I saw a couple years ago, maybe it was 5 years ago or more, like, talk about the marketing side. I mean, like a bag of Skittles will say fat free.
Right.
And you're like, wait, I don't think that's...
Exactly. Maybe not so much.
Yeah. All right. So you have been a real, as you talked about, real pioneer in terms of promoting healthcare freedom and healthcare transparency. Yeah. So I want to jump on that issue because that, again, to me at least, was the crown jewel of your various work last year. Can you talk? But you needed to build on that, and so it's a new session. You've got some bills that still relate to that. Can you walk us through kind of what the bill did in 2023?
Yes,
and then let us know kind of what was left on the table that you need to continue to pursue this year.
Yeah, absolutely. So I always start the story when I was a staffer in the Senate, and this was before I ever thought about running for office. I was working on healthcare policy, and I was working on this bill, and it was David Bellot with TPPF at the time. He had kind of worked with me on this, and so I was just a staffer trying to help Senator Hughes get this done. And we weren't able to get it done during that session, but I just heard from so many people about how important it was. And then I also heard on the opposition side that they didn't think there was a need for it. And so that kind of really stirred me up because it's just a straightforward bill. You know, all the bill that we passed last session required was after your healthcare services, you have to get an itemized statement that has all the billing codes on it, a plain language description so that you and I, who may not know medical codes or jargon, we will know what they did. And then also the price so that you could double check it. And, I don't know if you know this, the last time I looked at these statistics, it showed that 80% of medical bills have errors.
Wow.
And of those 80%, 90% are overcharges, right? And so to me, it gives a consumer an opportunity to look through their bill beforehand and see if there's any inaccuracies. And then they can address that with their provider or their insurance company, whoever it may be. But a lot of times, the most difficult part of this was even getting any kind of a receipt. That's what I call it. It's basically a receipt. You get a receipt when you go to the grocery store, when you go to Home Depot, everywhere you go, you get a receipt. And yet for healthcare, no one was getting a receipt.
And they would say things like, we're not able to provide one. Like, what do you mean? I can understand maybe at the beginning, saying we're not sure exactly which procedures or which machines we're going to use or whatever.
Exactly.
But you've already done the work. Yes. How can you not provide a receipt?
Exactly. And the other thing I heard during this whole thing was, it's way too expensive for us to do this. And I was like, okay, well, how much money are you actually going to save on the back end when it comes to your administrative duties? Because you're no longer going to have people making these calls to get an itemized statement or some form of statement. Now they're going to be calling with way more information. They'll be able to tell you, hey, can you double check this code or this, pricing on this or whatever. This doesn't coincide, but they couldn't give me any estimates on how much money that might save.
It sounds just like laziness. So they don't want to do the work. Well, I remember I think it was 2021. I was working with Dave on just sort of our general agenda for the year, and this was one of the things that he was pushing. And we always test everything. We, if it's going to be a major priority of ours, we always put it out there. I had never even really thought about healthcare transparency at all, and so we just put it on the poll. It came back, and it just blew up my face. It was, oh my gosh. We asked people, should patients receive billing information before they receive or before they get the treatment, right, or the treatment or the service. 94%.
Oh yeah.
Representative Davila, I have not seen 94% on any kind of polling question, other than our, should we celebrate, moms and kitties and puppy dogs. I mean, that's basically 94% jumped out, and I was like, that's something that we absolutely have to work on.
Oh yeah, absolutely. And just going back to last session real quick, I knew that as a staffer, there was some opposition. So I knew, okay, there's probably going to be some opposition this time too. And so what I did was I just kind kind of took what I did in the campaign and did it at the Capitol. I went door to door to members' offices the first couple weeks of session and just asked people to sign on to it. I explained the issue to the member or even the staff, whoever was in the office. I just dropped by, I talked to them, asked them to sign on to my bill. So by the time I presented it in the committee, I had 60 members signed on to it.
That's amazing.
And then by the time it actually passed, I had over 100 members actually signed on as co-authors and joint authors to the bill. Because to your point, it is a winning issue, but
I'm
there was
concerned
still
that there's opposition. There's still 30 or 40 members that decided not to sign.
It may or may not have been a top issue to kill for some folks, but anyway, I should add, I pray over all my bills and I ask the Lord, hey, what do you want me to work on? What should I pursue? And I prayed over this bill and I said, okay, Lord, if you want this to pass, then you give me the energy and, the hard work to do this, but I'm leaving the results in your hand. And so I know that, yes, 94% of Texans wanted this, but the Lord also wanted this bill to pass.
And he's the most important vote.
Yes, absolutely.
Well, that's great. So take me through the next, but it didn't do everything that you wanted it to do, or did it get watered down?
Yes.
What was the process that led you to now needing to add on to that bill?
Yeah, absolutely. So we wanted to make sure that we had a provision last time for this itemized statement to be provided through an online portal. And so what I realized after that bill passed and during the interim was not everybody has that set up. And so it's possible that it was sent to them, but they never saw it or they couldn't access their portal.
Okay.
Older people that are receiving help, sometimes they can't access the portal or they don't know how to set it up.
Yeah, my mom's a senior citizen and just refuses to use it. So I'm trying to tell her come on, this is how you get your information. And she's just like, well, you need to look it up for me. So,
right, there you go.
That's fine.
So exactly. So this session, we want to make sure that the consumer actually was able to choose. So that's how we're changing it, is that you actually, as a patient, will be asked how you want to receive it. So
great.
you have the option to take a hard copy, home with you, have it mailed to you, or, still with the online portal.
Yeah.
And then another piece of this bill is if for whatever reason you weren't able to choose or something like that, if the provider sees that your portal is not set up yet, then they can mail it to you.
Okay.
So that just providing more options. And we've already heard from HHSC that they've received 17 complaints so far that people are not getting their itemized statements. And I'll add, even in our office, man, we get calls all the time from people all over Texas that are asking us for help with this because they're still not getting it.
Well, you need to start dragging people in front of your committee.
Yes.
And get them in there.
Yeah. So we're hoping that we'll have a hearing on that bill soon, and we can talk about that.
And let me just tell you, my personal experience is, I know this is that your bill requires, like you said, on the back end, the receipt. But I was starting to see, even before that bill passed, I was starting to see my providers do more to let me know on the front end. Like they were either, I think just because, because the groundswell of support for this is so obvious, and because people are, hearing about it in the news and watching legislation go through the Texas legislature, they're starting to demand, no, I do need to have more information on pricing. And why can't you tell me? I get it. If you get in a car wreck and nobody's going to be like, hey, in the middle of your car wreck, which hospital do you want to go to?
Exactly.
But to Dave Bellotti used to say all the time, it's something like 90-something% are not emergency procedures. They're elective. And so you have time to figure out what is the best price and all that. And so my point is, I think that public pressure by you, highlighting this issue and then pushing it through the legislature is creating a situation where providers on the front end are already starting to make changes, and I'm certainly starting to see them in my own personal experience.
Yeah, well, to your point, I'm actually working on another piece of legislation that does try to help on the front end. So what this bill, it's HB 251, and what this bill does is you can get a good faith estimate from a lot of hospitals if you call them, and again, this is for elective procedures, right? And they'll give you an estimate. But there's no ceiling on how much they can actually charge you. So you can get all of these price estimates from all these different places. You can pick one based on it being the cheapest, and then they can can still send you a bill that's 1,000% more than the estimate, right? And so it's not always a true estimate. And so my bill says you can't charge more than 5% of the estimate that you give to somebody unless there's an emergency or something goes wrong, right? Because we're not all the same. You know, maybe you'll have an
heart
emergency.
Failure. Sorry, that's over 5%. I can't. Sorry, can't.
Exactly. We are not. We're not messing with that. But we also want to make sure that people can get this in a timely manner too. So we're saying in the bill that for rural hospitals, you should be able to get that estimate within 36 hours, and then for regular hospitals, actually reverse that. Regular hospitals, 36 hours, rural hospitals, 72 hours. And that way you have more time to shop around before you have these procedures.
That's great. And I'm just, I'm starting to see in my own areas and my wife and my family, we're starting to expect that. I mean, I certainly, having worked on this issue for 4 or 5 years, I ask. I mean, I say, if they're going to ask me, if they're going to tell me they want to do something or whatever, I almost always say, do you have a price estimate, or, what's it going to cost, or somebody to sit down. And generally it's awkward enough that like they don't want to be weird and be like, sorry, I can't tell you how much it is. And so they generally will concede on that. But I think it's because of the public pressure and because of efforts like yours that are pushing that as well. So so thank you for that. And so what is the timeline on the bill to make those fixes? Yeah,
so it's been sent to the Public Health Committee in the House and then the Health and Human Services in the Senate. And so I think we may have a hearing soon on it in public health in the House. But it is another, as you can imagine,
it's also
some opposition on this one too. So we're trying to work through that, and we're trying to work with everybody. I tell everybody I'd much rather work with everybody on issues like this because they're too important. In Texas, we only meet every other year. And so, if we don't get something done, that's just another year and a half that our constituents, that Texans don't get the help they need.
Well, you had a heck of a freshman year, and we don't want to see a sophomore slump. So we would love to be able to give you whatever support we can on that legislation if you need it. But I'm sure you can certainly handle that. I do want to get a couple other issues, a couple of fun issues. I just was in doing my research on some other bills because, of course, you are quite the workhorse in the House, and you've got a lot of really good legislation. This one is kind of tongue in cheek, but it really is near and dear to my heart as a suburban dad with way too much to do. And you've got a bill, and I don't have the number here. We'll talk about that. Yeah. But it would prevent homeowners associations from sending out fines. So I already like it. Yes. I'm already there. Sending out fines if I have discolored or brown vegetation. So if I'm not tending to my yard, when a city or utility company has put water restrictions in place. Now this happens all the time. I remember last summer I could only water my lawn once a week. Exactly. And when it was only after 7 p.m. or whatever the things are, and I'm thinking I might as well not even water it at all. It's just going to die, and I'm just wasting water. So what's going on? And but the HOA could certainly come by, and they did on occasions to maybe other lawns. But they'll take pictures and they'll say, hey, you need to fix your lawn and it's looking ratty. And I'm like, well, I would love to, but I can only water it at midnight on Wednesdays. How am I supposed to do this? So anyway, kind of tongue in cheek, but this is kind of a serious issue because you get dinged by the utility company if you water, but you also get dinged by the HOA if you don't water and you don't take care of your lawn. So this would essentially address that, and is very in line with our very strong sense of property rights here in Texas. Oh my gosh! So I do want to hear where did this come from? Did you have a disgruntled constituent that came and talked to you about this? Or?
Well, yes, absolutely on that point, but yeah, not even that, but even just one of the cities in my district too, because the leadership of the city had heard about this issue from their constituents. But I also had a town hall in my district about HOAs and heard so much. I mean, this bill is kind of scratching the surface of a lot of the issues that we heard from folks about. As you can imagine, when we talk about property rights, man, the HOA stuff just blows up.
I'm sorry, let's go back. You had a whole town hall. You voluntarily had a town hall that opened up the doors for people to come in and complain about their HOA. I'm surprised you're not still there. You might. Just one HOA. How did you get out of there? Did your husband have to come and drag you out?
Well, first of all, that's my job job. But,
yeah, that's great, though.
But
that's
no,
great. Wow.
it was great. You know, I had several one-on-one meetings with people, and so I just offered, you know what, let's just have a bigger meeting. That way we can get more input from people on what issues they're seeing. And honestly, it makes it easier for me because we had that, I think we had it last summer. So I had plenty of time to prepare for this session, and I was able to file this bill. It's HB 517. So it's a low bill number. It'll hopefully get through pretty quickly, but that's what, you know, those town halls help with. And yeah, we even added in the bill through the substitute that you also have 30 days after the restrictions have been lifted to get your yard green again or up to code again, because we realized, you know what, it doesn't go from brown to green overnight. So we also need to protect people on the back end. And we have gotten so much good feedback on this bill.
That's great.
Every member of the committee, after I laid it out, they were like, oh my gosh, Caroline, I hear about this all the time from my constituents too.
Was there, I just have to know, was the craziest thing that came up at the HOA meeting? Like, what was the craziest thing that a HOA, you know, had enforced on any of the constituents?
Well, okay. Well, I'll tell a funny one.
You don't have to name names or neighborhoods.
I won't.
You can tell me after the show.
No, it's all good. No, it was a neighbor that he had his trash can to where I think it was like 1/4 maybe of the trash can was showing. And so they made him, the HOA fined him for being able to see like this tiny piece of his trash can. Oh, so he had to put up, I think it was a wooden barrier to where you couldn't see this teeny tiny sliver of the trash can because it's like peeking outside of the fence or something. I mean, you know, just wild stuff like that. And then, you know, on a more serious note, there's a lot to work on in this topic. But, you know, we did hear about situations where the HOA would actually sue a resident, take them all the way through this court process, and when it looked like they may not get a favorable ruling, they would just drop it.
Yeah.
So you can imagine these homeowners are out thousands of dollars. Yeah. And so is the HOA, but they, you know, they have more resources, I guess. I don't know.
Just
so
people with too much time on their hands, I think.
A lot more to work on.
A friend of mine and I were talking about this today because I mentioned this story. And it's kind of a love-hate relationship, you know, because there's always that, you know, there's always that house on the corner that, you know, doesn't ever mow their lawn. And you're like,
go talk to those guys.
Come on. And that's what, you know, I guess that's what the Facebook group is for.
Yeah, there you go. Get everybody on board.
Passive-aggressive comments about people, you know.
Absolutely. Yeah, no. And I get it. Like, you know, being an HOA, yes, it does help your property value for sure when it looks nicer. So,
speaking of Facebook, you are prolific. Oh, maybe prolific's not the right word, but you're very active on social media.
Thank you.
I certainly follow you on all the social media, and I love not only, and you're not just doing the press release thing, or
absolutely.
You know, hey, look at here's my clip for me saying something at a thing. You know, you're actually letting people in on your day to day about what you're working on, whether you've had a committee hearing or 5 layouts that day or whatever. Which I really love. I think that's really exciting for your constituents. Is that what was the decision behind making that move? Is this something you've always been? Have you been on social media for a while and it's sort of come natural to you, or is this something that you just decided to do as being a representative?
Well, actually, I thank the Lord for my parents. They did not let me have a Facebook account when I was in high school. So,
we're working on that too, by the way.
I know.
The other
They're
Caroline,
way ahead of their time.
The other
by
Caroline's
the way.
working on that one.
So I'm so grateful because when I ran for office, I was like, I don't have anything on social media, so this is great.
That's awesome.
But really, it came from knocking on doors, and when I would knock on doors and let people know I was running for this position, a lot of people would ask me, well, what is the job of a state representative? And I loved it when people would ask me that, because if you think about it, you learn about government in high school, maybe you learn about it a little bit in college, depending on what your classes are, or what clubs you're in. But after college, once you start, you know, you have kids, you're working your jobs, all that stuff, you don't really learn about it anymore. It's very difficult to figure out sometimes what's going on in your own local community in a way that you can find out while you're raising your kids, you're working, you're trying to do all these other things, and you really only have, you know, 5 minutes for politics or local stuff or what's going on. And so that's my passion, is making it super easy for people to understand understand how government works, what my role is. I want people to understand and take pride in, electing people, voting, getting involved with the process. And, through social media, I get comments on my stuff. That helps me too. And to know what to work on. And
so she reads the comments.
Yes.
I'm sure your staff has probably told you 1,000 times and stop reading the comments. I know I was a flack for 20 years. I tell them, stop reading the comments.
There you go. No,
but that's great to hear.
Yeah, no, it's great. I love it. It's a really fun part of the job.
Well, speaking of how government works, the last thing I'll say, or last question I have for you, because I know you're super busy, you got to run back up to Capitol. You are not on the DOJ committee, but you have some legislation that they'll be considering here pretty soon.
I do indeed.
I'll try to prep it this way. For agencies that take federal money, of course, we all know that they don't just hand over the money and say, good luck.
Yeah.
They say, here are the 95
Definitely
things.
not.
Yeah, here are all the things you have to do with it, and you have no autonomy or no agency at all.
Exactly.
But there's no real accounting for that. There's no real accounting for, taking all this money from the federal government and then all the various strings that are attached and what they have to do and reports and all that kind of stuff. So you've got some legislation to address that. Tell us what it is.
Yeah, absolutely. And this really came out of being on the Transportation Committee last session. And because I'm a nerd, I was reading some almost contract language with just federal funding and for roads and stuff like that that they were giving to the state of Texas. And what I noticed was there were all of these Green New Deal, super heavy regulatory, environmental burdens that they were placing on states that they were giving this money to. And it really concerned me because it's hard to understand all that information sometimes. I was able to see that just when it came to transportation funding, but you can imagine with every state agency that we have in Texas, I'm sure the same thing is happening. Yeah. And so all I wanted was clarity. I just want to make sure that we know when we take federal funding, what are they going to require us to do? And if we take federal funding, let's say we take $1 million, is it going to cost us as a state more than that to actually implement what they want us to do? And if so, why are we taking the money?
And so would this be some sort of database or repository somewhere where people could look up and say, based on this money, we have to do these strings, and organizations like ours and other research organizations can take a look at that and start evaluating it.
Absolutely. So the way it'll work is the state agencies will report this information to the comptroller. Comptroller will put together a report and will disseminate that report. So yes, we'll have a lot of clarity, and it'll also help us as legislators with the next sessions, with the budget process, with understanding what our obligations are as a state. So I think it'll be super helpful.
Now, being from Round Rock, you saw at an early age what the heaviest congestion on a highway could possibly look like from basically North Austin all the way through Georgetown. So you literally grew up in one of the worst areas of the country. Is that how you ended up on transportation? Was that when you did your committee assignments? You're like, transportation. I will fix this for my community.
You know what? I did not request it my first session, but man, I did this session. Oh my gosh. And I cannot even tell you, poor TxDOT. I mean, we call them all the time because, yes, I-35 is horrible. But also, we have so much growth going on in Williamson County. And it's actually a hazardous conditions sometimes when you're changing the roads and you're redirecting traffic and stuff. So sometimes we have to call TxDOT and just ask them, can you put a traffic light here? Because there will be, thank the Lord, we have not had fatalities yet, but we did have a constituent call and say that he was in a car accident that could have been way worse, and that was one of the requests to get a light put up, and we did get it up. So that's the kind of stuff that I'm so grateful I'm on transportation to advocate for that stuff and for getting it done sooner so that our commutes are better.
If you'd like to throw us a bone down in Hayes County, I live in Kyle, so if you show some pity on us south of the river,
I do
it's
tell
pretty bad
people
down there too.
I tell people I adopt constituents all the time, so just let me know.
That's awesome. Well, Representative, thank you so much for being here. I know this is a lot of your time. This is great. We hit a lot of issues that we really want to talk about and want to get you in here and chat about. So we we will follow all these bills. Of course, we are very supportive of pretty much everything we talked about today.
Thank you.
So we're going to keep a close eye on that. And again, I don't know if they give out a sophomore legislator of the year, but you are certainly well on your way.
I don't know either, but I'll check.
Maybe it's just legislator of the year. Has a sophomore ever won?
Hey, sign me up. That sounds great.
That's fantastic. All right. Well, thank you so much for being here.
Thank you.
Really appreciate it. And thank you for listening. Thank you for watching. And as we always like to say at the end of our show, in the immortal words of Sam Houston, do good and risk the consequences. We'll see you next time.